Good morning, good morning, good morning. How are you? And thank you for listening to the Great Lakes Health Radio program here on Power 96.5 FM, WUFO AM 1080 AM. My name is Francesca Messiah, Manager, Workforce Development at Kaleida Health, and I am so happy you are joining us again on our two-part radio program. The first part of the show today, the first half hour, we will be speaking with Dr. Gillespie Sosa, and we'll be talking about fibroids and women's health issues. And the second part of the show today, we'll be talking about healthy eating on a budget. And we're covering all kinds of budgets. And that's the second part of the program that begins at 7:30. So before I introduce our guests, let me just give a little overview about Kaleida Health, because it's always a question in the community and a question in general. Kaleida Health, over 175 years old. I should say Buffalo General Medical Center, which is part of Kaleida Health, is at least 175 years old. Other buildings that are part of Kaleida Health are the Gates Vascular Institute, DeGraff Medical Park. Also at DeGraff, we have a long-term care center. Other hospitals include Millard Fillmore Suburban, Oshai Children's Hospital, and on the other side of Oshai Children's Hospital, within the same building, is Conventus. That's where several of the medical offices are. Also, we have Visiting Nursing Association of Western New York. That's where we give long-term care 24 hours a day, 7 days a week. There's High Point on Michigan, also long-term care and rehabilitation. And we have clinics and specialty care clinics for adults, for children, physical therapy, cardiac throughout Western New York and the Southern Tier. And in the Southern Tier, we do have two hospitals, one in Olean, New York, and another one in Bradford, Pennsylvania. That gives you a little bit about Kaleida. And don't forget, we have speakers available. If you're interested in a speaker coming to your event, or a health or wellness, or someone to talk about careers, we have all of that. We have you covered at Kaleida Health. Well, today's topic is a topic that someone probably brought up to me over a year ago. It has been at the top of my mind to find out who can discuss this. And I met this person. I met this physician, Dr. Gillespie Sosa. Good morning, Dr. Sosa. How are you?
Hi, Francesca. Hi. My
Hi.
first name is actually pronounced Jaleese.
Jaleese.
Yes, a
Jaleesa.
little easier than it looks. Just Jaleese.
Okay.
hmm
Thank you. And Dr. Sosa is obstetrician gynecologist at the Oshai Children's Hospital. And Dr. Sosa, how long have you been with Kaleida?
So technically, I've been with Kaleida just for a short period of time, but I actually trained at Kaleida hospitals since 2013. And at my previous job, my entire career, I should essentially say, I have done deliveries and surgeries at Kaleida facilities, both at Oshai Children's Hospital and at Millard Fillmore Suburban, despite my office being at another practice. But for the past, 13 years, I've been at Kaleida hospitals.
Oh, well, wonderful. Well, so I can't even say welcome because you've been here. Welcome. I could say welcome to the Great Lakes Health Radio program because it's your first time, but not your last time. So today's topic, we're talking about uterine fibroids and women's health issues, part one. Part one, because we know women's health issues and fibroids. Fibroids is a topic someone asked me about a long time ago. And I'm calling this part one because I know this conversation will continue. So fibroids, Dr. Sosa, what are fibroids? Where do they come from? And do men have fibroids?
I'm really
Uh,
glad we're discussing this topic because fibroids are actually pretty prevalent. About 70% of women will encounter fibroids by the time they turn 50. And in the African American population, about 80% of women will encounter fibroids. Fibroids are benign, thankfully. They're benign tumors of the uterus, and they are formed by the muscle cells that make up the uterus. So, a muscle is a large uterus. That's what allows it to stretch and expand when someone is pregnant. And those individual smooth muscle cells that make up that uterine wall, they sort of go rogue and turn into these growths that don't follow the rules and instead form these little tumors that look could be as tiny as a little pea to as large as a basketball or even larger over time. Um, where they come from, admittedly, we have not done sufficient research on fibroids. You might know from the federal level, or previous vice president was trying to do work to expand research on fibroids because it affects so many women. And so the little data that we do have, we know that fibroids may come from a genetic mutation, the MED12 gene, where someone may be born with that mutation, or over time that gene changes because of other factors that contribute to that change. And when that change occurs, the fibroid now develops significantly more receptors for estrogen and progesterone, which are the hormones that ovaries produce. And then they, again, just don't follow the usual rules. So they overgrow, they grow very quickly, and they grow very large and become these tumors that feel more like the consistency of a baseball. So usually the uterus may feel more like a marshmallow. And then when you have fibroids, these individual fibroids feel like a baseball. Do they affect men? Let's put it this way. Fibroids affect anyone that has a uterus. So if you have a uterus, you have the potential to have fibroids.
okay. Something you just mentioned, and number one, I was not aware that there was research that was being done in the area of fibroids, and that's glad to hear that that was. It sounds like it may have stopped, right?
Unfortunately, with all the other changes coming from a federal level, where research is being halted, but there are congresswomen who are really pushing to get that to go again. So there's hope for the future.
Oh, good. Oh, I'm glad to hear that. But have they found, do they know why African American 80%
Hmm.
are, why 80% of African American women, has that been any, are you aware of any reason that's been able to explain why?
Yeah, it's unfortunately a similar idea as several other conditions. For example, why American women may be at higher risk for maternal mortality and other diseases that are prevalent in the US. The reason is multifold. So one, a person may be born with that genetic mutation. Two, there are environmental and lifestyle conditions that could affect it. So, in several of our products that we use for self-care, so whether it's our perfumes or makeup, sometimes even like our face washes, skincare products, things found in relaxers can contain um, what we call endocrine disruptors. And so those endocrine disruptors may be found in less, um, let's see, less regulated uh, supplies, and that may be used more so in the African American community. And as a result, people of African American heritage may be at risk. Um, Other things like the genetic changes. So genes age, and genes can, their aging can quicken when there's more stress involved. And they have found that historically, because of racism, because of systemic inequities that affect African Americans, gene aging, something that's been termed weathering, occurs more commonly in those of African American heritage. And as a result of that weathering, there's a greater chance of those mutations, like that MED12 gene mutating, and as a result, causing fibroids and several other conditions that unfortunately may make African American women more at risk for these conditions. So a combination of existing in a community, in a society where inequities are prevalent, being exposed to environmental factors, whether it's because of location of where you live, even things like redlining can affect, where African Americans are found in a community, and as a result, what chemicals they're exposed to, therefore affecting these genes, therefore leading to fibroids, to things like lifestyle, whether someone eats more red meat, ingests more alcohol, those things can also factor into what makes African Americans more at risk.
That is amazing. And listeners, I will repeat this show in the future. So don't worry if you missed everything. Plus, the program will also be on our website. That what you said is such a mouthful and so much to grasp. I know that the program within a few weeks after it's aired will live on the Kaleida website. But that is just fascinating. And the Med 12 gene, that I
Yeah.
can tell right now, that's just a whole nother conversation in itself. Thank you. At what age do fibroids develop?
So we know that fibroids affect a person in reproductive age. So from the moment one starts to have a period to when those periods end, so at menopause. We've not we've not found fibroids in, a 9-year-old or a 12-year-old before they have a period. And we know that fibroids tend to grow more because of the effect of estrogen and progesterone, which start to be produced at what we call menarche, or when the period starts. And then once menopause hits, so once the ovaries stop making that estrogen and progesterone, fibroids essentially become ineffective. And for many women, they even shrink. So to make a long story short, the reproductive age from the start of a period to menopause.
Okay, and that can be a long time.
That could be a long time. I would say most folks, we encounter the fact that they have fibroids probably in their late 20s, early 30s. Most times in the 40s is where we tend to see them being the most problematic, because by then, if they've not been detected before, they're large enough to cause symptoms. And then as we age, as the ovaries slow down that production of the estrogen and progesterone hormones, the fibroids start to decrease in size and become less problematic. Sometimes I think this is important to know, as if they're African American listeners, you might be told by a physician, oh, you're close to menopause, your fibroids should not be an issue anymore. That may not actually be true for African American women, because that regression does not happen as rapidly as other races. And so you should still pay attention until that full, complete year of no periods.
Yeah, and I have to say that having been first diagnosed with fibroids in my 20s, I fainted when they told me because I didn't know what they were.
Mm.
But later on it was anyway. How many fibroids can fill a uterus? Because you said sometimes they can be as small as a ping pong ball or as large as a football, did you say?
Yeah, basketball, even larger. As many fibroids as the uterus could handle. I have been in cases where we have something we sort of determine it as miliary fibroids. So they're almost multiple pea-sized lesions, tumors, these fibroid tumors throughout the whole uterus. You can have hundreds of them that are that small, or more typically what we see maybe a few where you have a dominant one that may be the one that outgrows the others. So it's much larger, and then you have several smaller ones. So there's no limit to the number of fibroids one could have in one uterus.
How about warning signs? And this is your interview, not my interview. So I won't even talk about my warning signs. It was a eye opener.
Yeah.
But what are some of the warning signs from the medical side that you see?
So the typical signs are would be heavy bleeding. Most times you have a regular period, but it tends to be way heavier than one would consider normal. What often happens though is many women sort of just consider themselves as, oh, I'm the kind of person who just have heavy periods. And so they may not mention it to their doctor, or unfortunately, their doctor may not choose to investigate it. Heavy periods are not normal. A normal period, if you're using 5 or more pads a day, something's wrong. If you have to double up on a pad and tampon, something's wrong. If you're scared to leave your house because you might soil your clothing, something's wrong. If you have to lay down a towel at night in order not to soil your sheets, something's wrong. So heavy periods are the most common thing. You should have an ultrasound to check that out. Other things are affected by the size and location of the fibroid. So larger fibroids, you may actually feel them yourself. You may feel a firm area on your abdomen, on your belly. You may not be able to lay on your stomach without feeling some discomfort. So that might be a large fibroid causing that. Less typical signs, which might sometimes be falsely attributed to other conditions, maybe constipation, because the fibroid is pressing on your intestines. You may have urinary frequency because the fibroid is pressing on your bladder, so you tend to go to the bathroom more often. I actually had one patient who, for a long time, was treated for reflux, and she was on medication and wasn't getting better. They were increasing the medication. And then she came to see me and she mentioned it. And this was my first time seeing her. And I did an exam, and her uterus extended all the way up to her rib cage. So imagine from your pelvis all the way up to your rib cage, that's your entire uterus. She was having heartburn because that uterus was pressing on her stomach. So that's not a common sign, but it could also be one of those atypical signs that could be a sign of fibroids. So you never know. So it's really important to see a gynecologist regularly and have that pelvic exam so we could assess the size of that uterus because it doesn't always present as bleeding or pelvic pain.
And I have to say, what was mine? I was at a conference. I remember it was
Mhm.
New Orleans, and it felt like someone had just kicked the crap out of my side,
Oh man.
and I couldn't figure out what was wrong. So that pain, that extreme pain, I'll never forget. It was a conference. It was hot, and all of a sudden, I'm walking down the street, and whatever this kicking was, whatever it hit, just made me double. And then everybody kept telling me, because I was thinner then, kept telling me how fat I was getting real fat in my stomach. And I was
Hmm.
doing up to 500 sit-ups a day. And everyone was like, you're putting on some weight. No, those were my fibroids that were growing in my body.
My goodness. Yeah. That could happen. Yeah. So, again, sometimes the bleeding may not occur and you just have these other symptoms, the pelvic pain. Yes, that you're noticing that you're just gaining your abdomen is more and more looking like a pregnant abdomen. You should
Mhm.
definitely have your gynecologist check that out.
Right. And what are the treat? Oh, what are the treatments for fibroids?
Thankfully, we're in 2025 and we have several options. I like to tell my patients, this is not your grandma's fibroids, thankfully. So in the past, everybody's solution was a hysterectomy, and that is not the case. And that's something I'm quite passionate about as a gynecologic surgeon and one who tries to offer alternatives to hysterectomy. Uh, Hysterectomy is often the last resort and should not be the first thing you're suggested. The range of treatments go from medication, where it doesn't necessarily make the fibroid go away, but it may treat somebody's symptoms. You may have, there's some medications that suppress the ovaries from producing too much estrogen. And as a result, you may have no periods or shorter periods. And what that does is treat the symptoms, perhaps primarily of bleeding, and it may treat the symptoms of bulk, where the uterus gets smaller, somewhat smaller. so that you don't feel that discomfort or pelvic pressure from the fibroids. The issue with those is that they're only could be used for a short period of time, for a maximum of 2 years. And once you're no longer taking them, your ovaries start to work again. And so the hormones produced by the ovaries again can cause the fibroids to grow and those symptoms return. So those are usually effective in someone who may be close to menopause and has symptoms now and may just want something to carry them through menopause. They're an ideal candidate for that. Or for someone who just isn't ready for surgical management and or they may, be planning pregnancy in the future and they just want symptom relief for the immediate time, then that's a good option. The option that I most commonly do is myomectomy, which is the medical term for removal of fibroid. And I do these robotically where we have a minimally invasive procedure where you avoid the C-section scar and you have smaller incisions, and we go in and remove the fibroids through these small incisions. That's often helpful again for bulk symptoms. So usually when the fibroids are large, surgery is needed. So we are able to remove those large fibroids, causing some relief that, where your belly looks larger, that goes down, where you have pelvic pressure and pain, the constipation, the urinary frequency, it relieves those symptoms. Another procedure, which hopefully we'd start offering again at Collider, is called an radio frequency ablation of fibroids. This is another minimally invasive procedure done by gynecologists where we put a probe directly into the fibroid that we're looking at using ultrasound at the same time, and we burn the fibroid from the inside out. And this essentially what we call denatures or kills the fibroid, so it's no longer active. It shrinks to about half its size in a few months, and the bleeding is relieved. So that's called a radiofrequency ablation. The other procedure that a gynecologist may perform is the hysterectomy, like we mentioned. Again, I kind of think of this as a last resort. If nothing else works, if the patient is absolutely sure they're done child rearing and they are okay with removing the uterus, or they may have other conditions where removing the uterus is necessary. And that one also I and several other colleagues do robotically or minimally invasively, avoiding large scars up and down or C-section type scar. Outside of that, this is a mouthful. Radiologists, what we call interventional radiologists, can do a procedure which is actually a great procedure for the right patient. This is called uterine artery embolization or uterine fibroid embolization, sometimes shortened to UFE or UAE. And this is an in and out same day procedure where they run a catheter through your wrist from your vessel, your blood vessels in your wrist, all the way down to the blood vessels that supply the fibroids. They release these tiny microscopic little balls, silicone balls, that then plug and block the blood supply to the fibroid. And by blocking that blood supply, the fibroid has nothing to feed off of anymore. And the fibroid shrinks, it gets smaller, and your symptoms improve. For the right patient, meaning for this procedure, the UFE, you need to know that you definitely don't want to have kids in the future because it's not recommended in patients who might choose to get pregnant. And the size of the fibroid matters. The location of the fibroid matters. If the fibroid is in the cavity, we cannot do that procedure. If the fibroid is too large, we cannot do that procedure. But for the right patient, it's also a good option because you're back to work in a couple of days. The procedures I do, you may need downtime from work. So the myomectomy, hysterectomy, you may need to be out of work minimum 2 weeks, sometimes 4 to 6 weeks, depending on how many fibroids remove and how extensive the surgery is.
Thank you. And you know what? We are almost out of time. And I just want to make a comment on something you said about heavy bleeding going through the pads. If your grandmother or your great grandmother, your sister, if they went through all of this, they may have had fibroids and had never been diagnosed. If you're listening to this show and you're going through that, the heavy bleeding, using all the pads, all those things, the pain, how would they reach you, Dr. Sosa? Are you taking new patients?
Absolutely. Managing women with fibroids is a personal passion of mine. Again, because it has been understudied and because of the inequities regarding how we manage it. So you can catch me at either of my two clinics, Niagara Street OBGYN, 564 Niagara Street, and you can call me there at 716-768-7700. And at Kensington OBGYN, 462 Grider Street, 716-898-5000.
Thank you. And we have I think about 2 minutes now. My favorite question, because it happened to me, can fibroids return?
Uh, not that they can return per se, but that the uterus has that potential to make them. So yes, you may have a procedure where the fibroid's treated or it's removed, but remember, if you have that MED12 gene, if you're still exposed to those environmental factors, that uterus still has potential to make new fibroids. So it is important to do surveillance each year where we repeat ultrasounds to assess whether new ones grow. And maybe in part two, we could talk about some of the things you could take to help prevent growth of new fibroids.
Yes, and you know what? And let's do that because I'm one who had they came back. Matter of fact, I remember having so many the different ultrasounds. I learned how to read the ultrasound machine. I mean, I would laugh
Yeah.
at the technician because I could see I was but definitely part two. And what do you recommend? Tell me that so I can our guests will know we will have a part two. And what will we call the show?
Vitamin D deficiency is highly linked to fibroids, so you may need to be on a daily vitamin D supplement. And there's this other component of green tea. I'm not encouraging everybody to go out and drink green tea, but it's
No.
called EGCG. The name is pretty long. It's epicalogallate catechin that has been studied and shows to decrease the growth of present fibroids and slow the
Yeah.
growth of new ones.
Okay, well, you know what? On our part two, we will talk about that, and we'll talk about fibroids possibly returning and what to do to prevent fibroids. So, thank you so much, Dr. Sosa, for being our guest this morning on the Great Lakes Health Radio program. And listeners, don't go anywhere. Part two of our show, we'll be talking about healthy eating on a budget, which really healthy eating also ties in with fibroids, and we can even talk a little bit about good healthy foods to prevent fibroids. And once you have fibroids, on the part two of that show, but our part two is healthy eating on a budget with Kelly Cardamone coming up in a minute. Thank you, Dr. Sosa. Thank you so much.
Thank you for having me.
Oh, you're welcome. And now on to part two. Good morning, good morning, good morning, and welcome back to the second part of the Great Lakes Health Radio program here on Power 96.5 FM, WUFO 1080 AM. I'm your host, Francesca Messiah from Kaleida Health, Manager Workforce Development. And again, I'm just very happy that you've taken the time from your early morning, your busy early morning, to listen to the program that it's about our community, but bottom line, it's about your health. You are part of the community, and we here at Kaleida want to make sure that you are as healthy and your family and friends are as healthy as possible. Well, today's topic is food as medicine, and we a few weeks ago we had food as medicine part one, talking about the conference that was held a few months ago. However, we had so much to cover during the program. I know I said we're going to have a second part. So let me reintroduce our guest, Elizabeth, but Beth, I know, Mechiana, your last
Yes,
name. You mentioned that.
Macanica.
Mechanica. And Beth is a director of health and well-being at the Buffalo Niagara Medical Campus. And Purnima Mohan, who is the program manager and health and well-being coordinator at the Buffalo Niagara Medical Campus. And I also have to give Purnima a special thank you. When the Food is Medicine conference was held, I did a video, and I didn't think I could do it because I had never done a video. And she kept saying to me, "It's easy. You can do it." And then she left me alone, and I was like, okay, she said I could do it. So I want to thank you for giving me the confidence to go ahead and create that video. So thank you for the motivation. Um, so Food is Medicine Conference, just because we discussed this a few weeks ago, if we could just do a brief overview again of what was the Food as Medicine Conference and how many years has it been sponsored by Buffalo Niagara Medical Campus?
Thanks, Francesca. Good morning, everyone. And thank you for the shout out. You did an amazing job with the video and everybody loved it. So thank you for doing that and for supporting us. And
Well,
thank you
thank
for
you.
including us today. So the Food is Medicine Symposium, this was our fifth year hosting it. We started in 2021. It was a virtual conference at the time. We had about more than 100 people join us virtually on a Saturday. We had about 18 national speakers. We spoke about culinary medicine. The national curriculum was added to the medical school education. We also formed the Western New York Food as Medicine Coalition after the first symposium that we had. In 2022, we had about 16 national speakers, and we proposed the UB Teaching Kitchen within the School of Public Health and Health Professions. And a medical school Food as Medicine Wellness Group was also formed. In 2023, which was our third year hosting the symposium, we focused on value-based practices, transparency within the private food sector, food equity, and lifestyle medicine. 2024, we had about 200 or more people attend in person and 50 attend virtually. And 2025, this was our fifth year, our best year ever. We had more than 250 people join in person and about 50 joined virtually. We had 6 countries represented. We had an international keynote speaker this year from Icaria, Greece, who spoke about the blue zones from the Netflix documentary. We had 25 plus vendors. We had poster presentations. So all in all, this has been a great year.
Oh, thank you so much for providing the overview. Um, Food is Medicine, best practices for cold and flu season. What do the experts or what does the literature recommend? Because, sometimes is it a cold? Is it a flu? Is it COVID? So what are some of the best practices?
Yes, and this is a question I get a lot of as a registered dietitian, and thankfully there's a lot we can do just even behind and beyond the general hand washing practices, yearly vaccinations, and it may surprise you that it's way more affordable than a supplement. What we know from the research is our overall eating pattern. This is number one. It is the single most important thing that we can do that matters more than any vitamin supplement we can take. It's our overall eating pattern. And why is that? It's our gut, actually. A lot of people don't know that our gut, which is also called the gastrointestinal tract, is the only part of our body that is exposed to the outside world. And so it starts at our mouth, it follows the path of food all the way through our stomach and intestines and out. And because it's open to the air, it's quite sensitive to toxins and germs. And so in order to protect us, our body actually has over 70% of our immune system lives right there in our gut. And
In our stomach, you're saying your stomach, right?
Yes, exactly. And so it can help fight off bacteria, viruses, any other potential threats. And so by using food as medicine, we can help to support our body's natural machinery to fight infection. And what this really looks like and what the research is showing is eating as many plants as possible. The more colors, the better.
So, okay. So this is even if we run the show later, this show is being taped during football season. And without naming any brand names or anything, a lot of dips that come that are part of parties. They have cream cheese and more cream cheese and more cheese. So you're saying that if you eat a lot of these dips with cheeses, and don't and some and pizza, that 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 that's not good for your gut. That's not good for your stomach when it comes to the flu or cold.
So if the best thing you can do, if there are dips around, hopefully there's some fruits or vegetables like carrot sticks or celery, broccoli, cauliflower. That is the good stuff that's going to feed the bacteria in our stomach. Whether or not the cream cheese or cheese is there, it's there, but the more important part is what we're adding. And we want to see those colors, those plants. Maybe instead of potato chips, if you can bring to a party some crunchy nuts, trail mix, something like that, that's a really easy swap I like to recommend. You're still getting the crunchy, the saltiness, it's still really good, but is feeding your gut.
Yeah. Or you can even have a game at a party or play a game at your football gathering called Who Can Eat the Greatest Number of Veggies Without Dip? I don't know. I don't know how well that would go over, but to me, I would say give it a try. Has research proven certain foods impact our moods and immunity during winter months? And is the winter months in the Northeast, like Buffalo, or is it winter months across the country? And I hear a lot of that about people saying how in the wintertime, because it gets dark earlier, it's their mood. So you're saying it could be the food that's affecting moods and immunity?
Yes, definitely. The power is on the plate. And the season of the winter, it brings, depending on where you live, it might be cold, it might not. But regardless, at some point in winter, you're going to have more darkness. And that's nothing new to us in Buffalo. We're used to the dark and the cold, but a lot of us feel down. I know it's something I'm really sensitive to. My mood is very sensitive this time of year, and it's not our fault. It's just our body's reaction to this cold and lack of sunshine. And it's actually called SAD, seasonal affective disorder. And it's a type of depression that happens this time of year. But just like we talked about how our immune system is in the gut, our mood is actually no different. So about 95% of the serotonin, which is a special hormone that's known as the happiness hormone, that is made in our gut. And so that stabilizes our mood, it promotes feelings of well-being, and it regulates happiness. And what the research is showing, it's very promising. And it shows that the greater diversity of plant foods that we eat that nourish our gut can have this effect and help improve our mood. And so we have a lot of observational trials, randomized control trials, which basically just mean research where they take people and test a certain way of eating on them to see how it impacts their health. And we found that people that eat more olive oil, beans, whole grain breads, nuts, fish, fruits, and vegetables have much greater moods and improvement and reduction in their depression symptoms. So it's just very encouraging and motivating to know that the more plants we eat, the better our mood will be.
Thank you. And I have to also add that something I've started doing, probably since I participated in the Food is Medicine, not Food is Medicine, 40 Days to Wellness program, is making my own salad dressing. Oil, vinegar, and sometimes I'll use fresh garlic, which I love fresh garlic. And sometimes I'll use powdered garlic, which is no preservatives. And then I'll add some dried oregano to it and shake it up. And I have noticed, I guess, a difference in my mood or just a difference in how I feel since just using oil and vinegar. I don't know what's in the other salad dressings, Beth. I don't know if you know what's in the other salad dressings, but whatever it is, I try and stay away from commercial salad dressings because I just notice a difference in how I feel.
Yes. Do you use olive oil?
Yes.
That could be why. That could be why.
Yeah. That's another show. I don't even understand all the benefits of olive oil, but this one works. And is this just in the Northeast in the winter months when you talk about foods that impact our moods? Yeah, is it the winter in Atlanta or California, or is it more focused on the Northeast?
These foods will help your mood no matter where you live. Our biology is, innate to us humans since our existence, and our body knows what to do with it if you give it the right instructions. And food is instructions. So anything like leafy greens, berries, green tea, garlic, onion, like you mentioned, any of those spices, herbs, kiwis, probiotics are really great. So yogurt, kefir, all of that is going to, give your body what it needs to stay strong.
Okay, thank you so much. Um, can either of you share upcoming healthy living programs that will be sponsored in the 2026 year by the Buffalo Niagara Medical Campus, and how would people begin to find out about the programs?
Yes, thanks, Francesca, for that question. I'll be happy to share that. We are working on our 2026 programming for next year, and we're happy to announce that it's going to be called the Strive to Thrive Healthy Living Series. You'll be receiving information early January, but it's going to be a 6-month program, Jan through June. And each month is going to focus on one pillar of lifestyle medicine. So there are 6 pillars of lifestyle medicine. January, we're going to start with movement as medicine. It's going to be the last Tuesday of the month, and it's going to be virtual, so more participants can attend.
Oh, yay.
Nationally, yeah, we want to remove all the barriers of participation. And we're also going to have a fireside chat each month with a panel, and we'll have weekly fitness classes as well. So in January, we're going to start with yoga and build our core strength. We are also going to have monthly health challenges and a newsletter which is going to talk about tips on how we can move more. So that's going to be January, the first pillar. In February, we're going to focus on sleep, and it's all going to follow the same pattern with the newsletter, the fireside chats, and the monthly challenges. March, it's nutrition month, so we're going to focus on nutrition and food as longevity. In April, we are going to talk about social connections, and May is Mental Health Awareness Month. So we're going to talk about stress management and how we can master our stress with science and self-compassion. And in June, we are going to talk about avoidance of risky substances. So yeah, it's going to be exciting. This is a new concept that we'll be trying, and we want to incorporate all aspects of lifestyle medicine. So we've been doing food as medicine and also the stress management piece and the social connections, but we're adding a few more pillars, and we're super excited about that. And you'll be hearing from us soon, and our website will also have all the information early January.
Okay, so what I need for each of those that you just gave is one example of so social connections. What's one example? What's food chat? What's one example? So then, besides just hearing a title, what's one example to
Sure, I can
excite our
talk about,
listeners?
I can talk about March, maybe Nutrition Month. We're going to have a cooking class, a cooking demo aligned with that theme. So maybe a plant-based cooking, talking about benefits of healthy eating and all the colors you should be adding to your plate. So that'll be March. In April, the social connections, just maybe walking together with the family, step challenges, body workouts. So yeah, those are just some examples that we will be promoting.
Okay. Well, you mentioned a few months. We have a few more minutes. So what's a example of each of the different? Because you said each month is a different challenge, right?
Correct. Yes.
And
So
yeah, go ahead.
Jan is going to be movement, like I mentioned. So we'll be working on yoga and physical exercise. In February, we'll be talking about sleep. And each month, we will have a different fitness program as well. So we will incorporate yoga, the chakra yoga, or dance therapy. So we're still working on the specific details, but each month we'll have physical challenges and the health challenges that you'll actually be monitoring. And at the end, there's going to be an incentive if you attend, most of the virtual sessions and follow the weekly challenges. We're going to have an incentive at the end. And in March, we're also planning to have a touch point midway. It's going to be a BNMC Community Day where we can meet all the participants in person and also have like sort of restaurants there and different health and wellness vendors so you can talk to them.
You mentioned something, and either of you please chime in. You mentioned sleep, and I'm sure some people are thinking sleep. Like, what can you tell us about sleep? So what does that mean? Sleep. How does sleep fit into food as medicine? It's sleep.
So it's a lifestyle medicine, right? So, right, because everything is connected, right? It's like your physical activity, the number of hours you sleep, you're always on the go, right? We sleep, maybe some people sleep 3 hours or 4 hours. And so there's a certain number of hours that you're supposed to sleep. Healthcare workers and physicians, they're always on call, on the go. So we all need to sleep a certain number of hours before we can actually be, fully functional through the day. Beth, like to add something?
Sure. Yes, I'd be happy to. Yeah, and like building off of what Purnima said, it's the quality of sleep also. So not only the quantity, the number of hours, but are you having interrupted sleep, uninterrupted sleep? If you wake up, how soon can you get back to sleep? And regularity, are you going to bed around the same time and waking up at the same time every day? Or do you go to bed at 7, sometimes 10:30, sometimes 1 a.m.? What does that look like? Because that has an impact on our well-being. And interesting enough, how we sleep affects how we eat, and how we eat affects how we sleep.
And how is that?
So if we eat too soon before we go to sleep, it's going to disrupt our sleep and keep us up. So you want to always wait at least 2 to 3 hours to not eat anything before you go to sleep. And then also, if you're not sleeping, having good quality sleep, that's going to make you more hungry the next day. And there's actually research to show that it affects your blood sugar. So it affects your cravings, and it shows people just crave a lot more of those sweeter foods, and they tend to eat more calories if they don't sleep well.
All right. Well, I'm always interested in that. I have a tendency to wake up around 5 in the morning and look at Facebook or look at emails. When I think, okay, well, if you're up, why don't you do some laundry, exercise? So I would definitely be interested in learning about the sleep. Community Day at Buffalo Niagara Medical Campus. That sounds really fun and exciting. What is Community Day?
Yeah, it's something new that we're going to be introducing in 2026, actually. So in the past few years, like we talked about for our symposium, our audience has been a mix of healthcare workers, physicians, community members, but some topics, work for some and didn't work for everyone. So we decided to do a symposium for 2 days, which is going to be on October 15th and 16th in 2026, which is going to be primarily for the healthcare workers and physicians. And the community day, which is going to be in March, is going to be on a Saturday all day, and it's going to be for the community. And that's going to be no cost to attend. We're going to invite some healthy restaurants to provide some samples, and we'll have different health and wellness vendors who are going to be talking about all the 6 pillars of lifestyle medicine, like we spoke.
And it'll be inside in the month of March, right?
Yes, it will be indoors.
Okay, that's not to make sure. I've been on committees where some people are like, "Oh, there's that nice day in March." Well, they're normally pretty cold, but that's okay.
Yes.
How about the 2026 Food as Medicine Symposium? So I know it seems like a long ways away, but it's October of 2026, and I know to you it probably feels like it's around the corner. So what are the planned or potential plans for 2026 Food as Medicine?
Sure. Like I mentioned, as of now, we have the dates scheduled. We are still working on the topics and the agenda, but there'll be more focus on lifestyle medicine for sure. But yeah, stay tuned. We'll be working on that early next year.
Okay. And something that was mentioned earlier, I think Beth mentioned, and the two of you can co-author a book. And this is what I would call it, the power is on the plate.
Love
Because,
that.
yeah, I mean, it's so true. You know, gravy versus no gravy, heavy salt, but the power is on the plate. I have to say that is my takeaway from, especially from this conversation. We are in December of 2025, which is everyone has a New Year's resolution. So is there anything, as we've talked about food as medicine, is there any a couple New Year's resolutions for baby steps towards that person who's just thinking about food as medicine and getting healthier? Your recommendations.
I would love to start with something very actionable and easy to do. Especially, I think a lot of people make the resolution like, okay, I got to lose weight, get the gym membership or things like that. But it doesn't even have to be that. And we know actually a lot of research and just even in general, we know we feel good when we're with other people, right? That feels good, whether you're meeting someone for a walk or you're eating a meal with them, maybe you're meeting a friend for coffee. Social connections are so important. And the hormones that we release when we're with other people is medicine itself for our body. So I think, loneliness is a really growing public health crisis, and it affects our immune system, our cardiovascular health, our mental well-being, and even how long we live. So I think something really easily we could do is just planning to have a meal with a friend. Maybe it's once a week, maybe it's at your house, maybe you go out to eat if that's in your budget, but choosing connection. And it shows that we don't tend to eat as many calories actually when we're with our friends and we have a slow meal and we're relaxed. And there's a lot that comes from just, being in rest and digest mode and being calm and being with someone you love. So I think that's just a really easy, healthy way that's holistic and kind of connects all these different principles.
Yeah, thank you. But I'll just like to add a couple more. So little things, right? All the small steps that we take, maybe, walking 5 minutes more every day, like taking the stairs, stretching, drinking water, cutting out on the sugary drinks that we have, adding more fruits and veggies, like Beth mentioned earlier, portion control of what we eat, just little things, limiting our screen time. And I think just staying consistent and committed in practicing, lifestyle medicine to improve our health. And I just like to leave with one quote. I love quotes. So we shouldn't be adding more years to our life, but we need to add more life to our years.
Okay, that is a great quote, and I have to share with our listeners. When I became really very interested, I was interested in food as medicine when it first came around, but a couple of years ago at Kaleida, there was this email and asking employees if they were interested in participating in this program called 40 Days of Wellness. It was a New Year's resolution of mine to start to get healthy. And when I read this, like probably over a month or so, I kept seeing it come across the screen. I just signed up and I was what part of the 40 days to wellness, and that's how I got started and hooked and doing things like using olive oil and vinegar for a salad dressing and eating broccoli and just obsessed over lettuce. So it does work. It was a small resolution. Did I know how I was going to get there? No, I didn't. And I have to say, I left it up to God, and I said God will point me in the direction. And sure enough, here came this 40 days to wellness. And I've been friends with Beth and Purnima ever since. So thank you. It did start as a New Year's resolution to be healthier, and I didn't know how. How your website? How would people get in touch, keep up with you? And that is another resolution, just to begin to get on this website so you can receive this information. What's the best way, ladies? What should they do?
Yeah, it's bnmc.org/health and well-being, and you can sign up for our newsletter. You'll be receiving all the updates, and I'll be sure to send out an email as well to my listserv that I have, just 1,000+ people, and you will receive all the monthly challenges and information about our lifestyle medicine program.
And say it one more time, please.
It's www.bnmc.org/health and wellbeing.
And that stands for Buffalo Niagara Medical Campus. So if someone were to go to the Buffalo Niagara Medical Campus, would they also, is food as medicine a tab or something on the website?
It is under health and well-being. Food as medicine is a tab. Yes.
Okay, so there is another way. I can't thank you ladies enough, because y'all have made a big difference in my life, that's for sure. And I want everyone else to feel as good and to get connected. And the power is on the plate. That's what we talked about today. We just can't say enough about it. But I just want to thank you for the heart. I just want to thank Elizabeth Manchina. I know I keep Macnica, Director of Health and Wellbeing, Buffalo Niagara Medical Campus, Purina Mohan, Program Manager, Health and Wellbeing, Buffalo Niagara Medical Campus. And you've been listening to the Great Lakes Health Radio program with your host, me, Francesca Messiah from Kaleida Health. Remember, the power is on the plate. And in 2 weeks, you'll be hearing from me and my guests. My guests are what makes the program. It's not about me at all. It's about the guest. So listeners, be well, stay healthy, and God be willing, you'll hear my voice again and 2 exciting guests in 2 weeks. Bye-bye.